So, looking at the next terminology, which is related to menstruation, we'll be looking at what is known as polymenorrhea. So, we're going to look at polymenorrhea and we'll talk in depth on it. So, for polymenorrhea, we said that it just refers to frequent menstrual cycles. Poly, something is too much, something is excess, polymenorrhea. So, it's typically defined as having periods, that's menstrual periods, that occur less than 21 days apart. So it's very frequent. So in a year now, a woman is having more than the 12 periods that a woman is supposed to have. So while the bleeding itself is usually normal in volume or duration, all right, you have a short cycle, so therefore you have a frequent cycle that can be disruptive and may signal that there's an underlying issue. So many things could actually make you have a lot of menstrual periods in a year. Things like hormonal imbalance, so especially have estrogen imbalance, progesterone imbalance. Then anovulation, this is when ovulation doesn't occur, so this disrupt the cycle. Short luteal phase is a post-ovulation phase. Now it's too brief for proper cycle regulation. Then thyroid disorders, the thyroid hormone could be too much or too little. Polycystic ovarian syndrome may cause polymenorrhea or oligomenorrhea. Then perimenopause, so sometimes as a woman is approaching menopause, her cycles are becoming so short. So stress, weight changes, intense exercise, all of this could actually impact your hormone balance. Then sometimes uterine fibroids or polyps. Alright, so symptoms to watch out for is the menstrual cycle is usually short, very brief, alright, repeated. Fatigue or signs of anemia due to frequent blood loss. Pelvic pain, mood swings, hormonal symptoms depending on the cause. So diagnosis is, of course, we are trying to track the menstrual cycle, to see how it is going. Hormonal testing just to see the levels of follicle stimulating hormone, luteinizing hormone, thyroid stimulating hormone, prolactin. Pelvic ultrasound, they are checking for fibroids or ovarian issues, right? The endometrial biopsy, hysteroscopy, right? All of this. So treatment is hormonal therapy, like birth control pills, iron supplements if anemia is present, lifestyle changes, like you manage your stress, you balance your nutrition, you balance your exercise, then treat any underlying issues like thyroid disease or polycystic ovarian syndrome. Then surgical options if the person has fibroids or polyps